White House National Monkeypox Response Coordinator Robert Fenton says cases are down nearly 50% since the beginning of August.
Sounds like good news, right? This comes as the number of infections in the U.S. nears 23,000, though. Fenton said new research from the University of Pennsylvania shows knowledge of monkeypox vaccines has increased from 1/3 of Americans to more than 60%. Today, the director of the CDC asserted they have, quote, learned some lessons from COVID-19 about how to promote vaccines to the public.
We're taking those lessons learned and doing that hard work of community outreach. We've seen successes through doing so. We've seen them in these large equity events and these large gay pride events. And now we will continue to do the hard work and reach the smaller events as well.
Joining us now is Dr. Céline Gounder. She's the editor-at-large for public health at Kaiser Health News and an internist, infectious disease specialist, and epidemiologist, as well as our CBS News contributor, which we are so appreciative of. Great to see you, Dr. Gounder. What do you make of what Dr. Walensky said there? Lessons learned through COVID and the pandemic, and that's helped perhaps messaging. What do you attribute the gains to right now, and how much more is still to be done?
Errol, it's really hard to attribute all of the decline in monkeypox cases to vaccination. Most of the people who've been vaccinated have gotten one dose. We're really just starting to give second doses. But I do think some of the messaging we learned during COVID has been useful. So we know that about half of men who have sex with men in this country have actually changed their behavior to reduce the number of partners, fewer anonymous partners, using apps a little bit less. And that certainly has had an impact. But we also know from COVID, behavior change doesn't always stick. People aren't wearing masks anymore, for example. And so when you're asking people to change their sexual behavior, it's not clear that that will stick long term. And
there still is a limited availability of the vaccines, correct? They're still only available to people in the highest risk category, men who have sex with men. Is that correct?
That's right.
Yeah, so there's still that to contend with. But in terms of, the way the monkeypox virus may be mutating, federal health officials are warning that it may be only one mutation away from evading a key antiviral drug called TPOXX. How concerned are you about that? And should we be more concerned about mutations?
TPOXX is the one drug that really does seem to be truly effective against monkeypox, but it's still an experimental medication. Patients who are receiving it are doing so in the context of scientific research, clinical studies. And I think that's really important because, as you note, there is a risk of developing just one mutation and it doesn't work. And so scientists, doctors will be following to see if those mutations occur.
Right.
And we don't want to be alarmists, but we've got to be realists. And polio has now reemerged as a threat. The first confirmed case is here in the States. New York State has declared now a state of emergency over that diagnosis. Why a state of emergency over one case, and what does it mean for the rest of us?
We know statistically that one case is just the tip of the iceberg. So when you see one case of paralysis, that means you've already had about 2,000 cases, infections for that one case.
Oh, I see.
So it's a lot more
scary.
widespread. And then we're also seeing in wastewater, so sewage water, at least 4 counties have had spread related to that one case of paralysis. And those counties, by the way, are among the bottom in New York State in terms of polio vaccination rates. So there's a huge vulnerability there. And I am concerned if we continue to see spread, we really could be facing a big problem.
Because it's more concerning once you see the spread that's not related to a known case, correct?
Well, that would imply that it's not community transmission, that you can't follow chains of infection. We're not really trying to do contact tracing in the case of polio, but when we see this kind of widespread community transmission, that is really worrisome, and it means we absolutely need to make sure kids are up to date with all of their vaccines, including polio, and really do need to stay on top of this.
And the headline seems to be just make sure your vaccinations are up to date with everything, wash your hands in general, and don't get too close to strangers. Does that still apply?
I think that's pretty good.
That's pretty good.
Wash your hands, absolutely.
Polio, though, really scary. We don't want to see that one make a comeback. Dr. Céline Gounder, thank you so much for joining us. We appreciate it.
Thank you, Doctor.